You ever notice how much better you feel on a bright day? More energy, better mood, clearer thinking? Well, you're not imagining it. There's a biological reason why movies show joy and hope in the sunlight and sadness in the darkness. The sun is literally sending signals to your body. And yet, most of us are light deficient. Surveys suggest that around 40% of US adults are vitamin D deficient. At the same time, sleep disorders, fatigue, mood swings, and metabolic disease are rising. And many of these issues tie back to disrupted light exposure. When we miss this daily input of sunlight, it doesn't just affect our mood, it ripples into hormones, metabolism, cardiovascular health, and even chronic disease. Today, we're talking about one of the most accessible, free interventions you can use every single day to support your hormone balance, mood, metabolism, and sleep. Welcome to the Medical Disruptor, a place where well-versed women can ask the hard questions and get evidence-based answers you won't find anywhere else. Our community is always informed, empowered, and science-backed. I'm Dr. E, the NP with a PhD, and I help smart, well-versed women go from medically gaslit to medically empowered. Guest episodes are where I sit down with clinicians who expand past their training. Solo episodes like this one is where I dig into one issue in depth, and you can find all my citations in the descriptions below. And today, of course, we're talking about sunlight. Here's the big picture. Your body is designed to interact with sunlight every day. And when it doesn't, things start to unravel. Fatigue creeps in, mood shifts, metabolism feels stuck. You've probably lived the story. You bring these concerns to your doctor and the response is familiar. Well, your labs are normal, maybe it's stress, maybe it's age. And it could feel dismissive, and more importantly, it leaves you without any practical tools of how to feel better. Now that's where agency comes in. I want you to get ownership of your health, and today I'm gonna put one of those tools back in your hands. Sunlight, a simple, free intervention that influences nearly every system in your body. Let's start with vitamin D, because that's what everyone connects sunlight to, is vitamin D. When sunlight hits your skin, it's not just warmth, it's chemistry. UVB rays interact with the cholesterol compounds and kick off vitamin D production. And vitamin D isn't technically a vitamin, it's a hormone precursor, means it becomes a hormone. Once it's converted into its active form, it regulates over 200 genes. It touches nearly every tissue in your body. It's not just about your bones. What that means for you, yes, stronger bones, but also better immune function, lower inflammation, more stable mood, and even improved insulin sensitivity. And you don't need expensive protocols. Just go outside for 10-15 minutes in the morning sun or several times a week. And that's enough for most people. And here's the evidence. Randomized controlled trials show vitamin D supplementation lowers cancer mortality by about 16%. Observational studies link higher vitamin D levels with lower risk of heart disease and all-cause mortality. And a 20-year Swedish study of nearly 30,000 women found that those with regular sun exposure had lower mortality rate than those who avoided it. A simple blood test, 25-hydroxy vitamin D, shows where you stand. Many clinicians consider between 40 and 60 to be optimal range. Watching that number rise after consistent sun is proof that your daily choices are changing your biology. Now, a little disclaimer and an explanation of that why you might hear some conflicting advice about being in the sun. That same Swedish study, those women who lived longer overall with regular sun exposure, they also showed a slightly higher risk of skin cancer. And how is that possible? Well, that's where nuance matters. Yes, sun exposure is a risk factor for skin cancer, but not all exposure carries the same risk. I'm not recommending high-risk behavior, and I'm certainly not telling you to bake in the sun all afternoon because Dr. E said I should go in the sun. Think of it this way. Driving always carries some risk of an accident, but most of us still get in the car because the benefits, getting to work, seeing loved ones, getting to the doctor, far outweigh the risk. We understand that risk is managed by how we drive, the precautions we take. Sunlight works the same way. So the key isn't to avoid it, it's moderation. Brief, intentional exposure, especially to early morning light. And if you live in northern climates and have darker skin or a history of skin cancer, it makes sense to lean more on food, supplements, or light therapy devices just to keep safe. Now, while we're talking about skin, I'm going to share a surprising and even maybe counterintuitive fact that light itself can be medicine for certain skin conditions. We use controlled UV therapy as a standard treatment for psoriasis, and studies show that it helps eczema too. Some evidence suggests benefit for acne and possibly autoimmune conditions like lupus or IBD. All of that is to say that sunlight has so much benefit for your skin. Now let's turn to your internal clock. Let's turn inwards and see how light can affect all of your internal processes. The moment morning light hits your eyes, a cascade begins. Light signal travels to something called your suprachiasmatic nucleus, SCN. It's the master clock in your brain. That clock sets the rhythm for cortisol, melatonin, body temperature, metabolism. So just seeing that light in the morning sets off a whole cascade of your internal clock. Think of it as like a flower that opens at dawn and closes at dusk. Your body is built to respond to those same light cues. And here's what you can do. Within an hour of waking, step outside for 10-20 minutes. Don't stare at the sun, just let daylight hit your eyes. If you need sunglasses, that's fine. It's not ideal, but you can listen to your body. And if it's dark or winter, you can use a light box. Studies show that morning light links to better sleep, more stable mood, improved glucose, metabolism, and lowers BMI. And yet, when women report fatigue, waking, and poor sleep, light exposure almost never enters the conversation. Again, we understand that the role of the PCP may not be to discuss this, but it would be pretty cool if we did. I'm also not saying that sunlight is a cure-all, but we can't overlook that our bodies evolved expecting these natural inputs, sunlight, movement, good food, and sometimes the simplest, most intuitive steps lay the foundation before we complicate things with protocols and prescriptions.
Quick little break. If this episode is hitting home, you need this. I made a free guide called the 5 red flag phrases that signal medical gaslighting. Because if you know what to listen for, you'll know when to push back. Politely, of course. Check out the link in the description. Now let's keep going.
If your body is so affected by daily sun exposure, just imagine what seasonal changes in the sun availability will do. Actually, you don't have to imagine it, I'm going to tell you. Your brain has a built-in antidepressant system, and it totally depends on light. Bright light stimulates serotonin production. Serotonin is our happy neurotransmitter. It regulates mood and appetite and sleep and pain perception. Without enough light, that system underperforms. You don't get to turn on your built-in antidepressant system. And here's the evidence. Light therapy is as effective as antidepressants for seasonal depression, with faster onset and, of course, fewer side effects. A JAMA psychiatry trial showed light therapy also helped non-seasonal depression with significant mood improvements in just 4 weeks. If every winter you've been told to just push through it, that's not resilience. It's biology missing an input. Seasonal depression is absolutely a thing, and honestly, I can actually attest to that. I do not do well in the winter, and I really, really need my red light therapy during that time. Now, mood is not the only system that can take its cues from the light. The same rhythm that stabilizes serotonin also shapes how your body handles energy, weight, and blood sugar. Weight and blood sugar are not just about calories, they're about timing. Your metabolism runs on a circadian rhythm, which is anchored by the light. Morning exposure supports cortisol rhythm, insulin sensitivity, and appetite hormones. Here's a classic case study. A night shift nurse, frustrated by weight gain, rising fast glucose despite being diligent with diet and exercises. If she added a bright light device during her morning hours and made time for outdoor light when possible, the research suggests that she could see improvements like bringing fasting glucose down from pre-diabetic range towards normal, all without changing the food or the fitness. So while light isn't a magic bullet, it is definitely a lever that you can pull. And when women are counseled only on food and exercise, leaving this information out is not really complete care. And sunlight doesn't just influence blood sugar, it also plays a role in blood pressure. And when you step back, it makes sense. Your body's a network of chemical and mechanical systems designed to respond to the sun in order to function and thrive. The blood pressure connection in particular is deeply rooted in our evolution. Your skin actually stores a compound called nitric oxide. When sunlight, especially UVA rays, hits the skin, some of that nitric oxide gets released into your bloodstream. And once there, it helps your blood vessels relax and widen, which naturally lowers blood pressure and improves circulation. And this is not random. There's an evolutionary reason for it. Our ancestors lived outdoors, not under fluorescent lights. In hot climates, widening blood vessels, right, they open up in response to sunlight, helped regulate the body temperature and prevent overheating. Over time, our cardiovascular systems came to expect this daily cue. Without it, as happens to most of our people who live indoors, these natural pathways of opening and vasodilated are underused and baseline blood pressure creeps higher. Why does this matter? Because high blood pressure is one of the most common and silent risk factors for heart disease and stroke, the #1 killer of women. And unlike most blood pressure intervention, this one is free, simple, and doesn't require a prescription. Of course, sunlight will not replace your medication for people who need it, but it shows us something powerful. Light is not just about mood or metabolism or vitamin D. It's cardiovascular intervention, one your body was designed to use. So to recap, your aha moment, the point where the science connects back to you, what you've just heard, the vitamin D system, your internal body clock, serotonin, blood sugar, even blood pressure, these are not random trivia points. They are proof that your body is already wired with healing systems. And the missing ingredient isn't another medication. You know I'm not against medications if you need them taken. And it's not another expensive protocol. It's light. Not pills, not procedures, light. Your body has agency. You have ownership over your health. Every time you step into the sun, you are turning on switches, regulating genes, resetting hormones, stabilizing mood, improving metabolism, and lowering blood pressure. And you don't need permission to start. You don't need to wait until your doctor agrees this matters. This is the things that you do between the doctor's appointment. You can claim this tool today. And this is what reclaiming health looks like. Understanding your biology and choosing to give it what it needs. So what are immediate next steps? 1, get morning light daily. Within an hour of waking, spend 10 to 20 minutes outside. If it's a dark morning, you can use a light box for 20 to 30 minutes. They're on Amazon, easy to find. Track patterns. I love tracking patterns. For 2 weeks, jot down your sleep, your mood, your energy, your cravings while you add the morning light and just see what changes. Look for the changes. You'll probably notice the shifts before your labs do. As for testing, request a vitamin D level, 25-hydroxy vitamin D blood test, and discuss the results with a clinician. You're aiming for somewhere between 40 to 60. And of course, we still have to be safe. Layer in safety. Keep exposures brief and intentional. Use protective clothing for anything beyond those short doses. And if you have skin cancer history or eye conditions, tailor this with your doctor. Now, an optional advanced step is something that I love, which is red light therapy. These are panels or handheld devices that use red or near infrared wavelengths that can support skin health, wound healing, inflammation, and muscle recovery. Remember, red light works locally and sunlight regulates whole body systems. So it's nice to have, but it's not instead of. Think of red light therapy as a bonus layer. Useful, but never a substitute for daily sun. Bottom line, sunlight is free. If used daily and intentionally, it works like medicine. It supports your bones, your immune system, your metabolism, your mood, your blood pressure, and even your skin. Your symptoms are not imaginary, they're information, they're signals, and you have more agency than you've been led to believe. Your body is not waiting for permission, it's waiting for light. Step outside, let light in, and start reclaiming your health one morning at a time. And this brings us to the end of another episode of The Medical Disruptor. This is what medical disruption looks like. Not blaming, but exposing the limits of training and pushing the conversation forward. You're part of a community that doesn't exist anywhere else. A safe space for people who want real scientific information, but also want to ask questions without being made to feel crazy. Our community is informed, empowered, and science-backed. If you're ready to go deeper, go on my website, drafratlamandre.com. It has my book, PDFs, newsletter, and a link for consults. Until then, keep asking questions, keep asking for more, and keep disrupting.